Welcome to Golden Glow Health, the channel where we share useful knowledge and healthcare experiences, especially for older adults in the US. Today, we will explore the topic, 5 common symptoms of high blood pressure you should not overlook. High blood pressure is one of the most serious and prevalent health issues, particularly as we age, making our bodies more vulnerable to damage if not given timely attention. In this video, we will highlight early warning signs that you might not have noticed, from persistent headaches, the dizziness experienced when standing up too quickly, to irregular heartbeat, prolonged fatigue, and changes in vision. These symptoms can sometimes be quite subtle and may be easily confused with other health concerns. However, identifying these early signs can empower you to be more proactive in monitoring your health, enabling timely prevention and treatment to avoid potentially dangerous complications later on. Golden Glow Health is committed to providing you with accurate medical information, presented in the most understandable and practical way possible to help older adults feel more confident in managing their own healthcare journey. Join us as we delve deeper into the symptoms of high blood pressure, and remember, taking care of your health is the golden key to a fulfilling and happy life. Symptom 1. Frequent headaches. Frequent headaches are one of the key warning signs of high blood pressure, especially in older adults. If you experience recurring headaches, particularly in the back of the head or forehead, it could indicate an issue with your circulatory system. Headaches caused by high blood pressure are not always severe, but if they persist or appear suddenly, they should be taken seriously. As we age, the body's natural ability to regulate blood pressure may decline. When blood pressure rises, the pressure on the blood vessels in the brain increases, leading to headaches. This can be not only uncomfortable, but also a potential precursor to serious complications such as a stroke. Some people describe the pain as a feeling of pressure or as if a cloud is weighing down on their head, making it difficult to concentrate and even causing sleep disturbances. If left unnoticed and untreated, these symptoms can lead to severe consequences. Additionally, headaches may be accompanied by other signs such as dizziness, fatigue, or even nausea. In older adults, the body often responds to high blood pressure with subtle symptoms, and headaches are one of them. If your headache feels different from usual or cannot be explained by common causes like stress or lack of sleep, it's essential to check your blood pressure regularly. Recognizing frequent headaches as a symptom of high blood pressure allows you to take proactive steps in managing your health. If you have a history of high blood pressure or cardiovascular disease, paying attention to signs like headaches should not be overlooked. Don't hesitate to discuss any unusual symptoms with your doctor or healthcare provider. Your doctor can measure your blood pressure and recommend necessary tests to determine the exact cause and provide appropriate treatment. Moreover, maintaining a healthy lifestyle and reducing stress play a crucial role in managing blood pressure. Try to follow a balanced diet rich in fiber, low in salt and saturated fats, and incorporate regular physical activity. Small lifestyle changes can make a significant difference in blood pressure control and headache reduction. Also, ensure that you get enough restful sleep, as good sleep is essential for overall health. Detecting frequent headaches early can help you adjust your lifestyle and receive timely treatment, protecting your health in a comprehensive way. Take care of your well-being daily, and remember to monitor your blood pressure regularly to live a healthier, safer, and more fulfilling life. Symptom 2. Dizziness and loss of balance. Now, let's move on to the second symptom, dizziness and loss of balance. For many older adults, this symptom is not only an indication of fluctuating blood pressure, but also a warning sign of the risk of falls, which can lead to serious injuries. When blood pressure rises, the blood vessels supplying the brain may experience uneven pressure, resulting in dizziness when standing up suddenly or during changes in position. In older individuals, the body's ability to regulate blood pressure when transitioning from lying down to standing may weaken over time. This means that when you stand up quickly, blood may not circulate to the brain fast enough, causing dizziness or a temporary loss of balance. Even if dizziness feels mild, frequent occurrences can significantly increase the risk of falls and injuries. Falls can result in fractures or other severe injuries, especially for those with osteoporosis or joint problems. Beyond physical risks, loss of balance can also negatively impact daily life. When the body constantly feels unstable, even simple activities such as walking, cleaning, or standing to chat with friends can become risky. This not only affects independence, but also leads to psychological stress, making older adults feel anxious and reluctant to engage in social interactions. To mitigate these risks, regular health checkups and blood pressure monitoring are essential. If you experience dizziness or balance issues, the first step is to stop and sit down to prevent further imbalance or accidents. Avoid making sudden movements that could worsen the condition. If dizziness persists or occurs alongside other symptoms such as chest pain, shortness of breath, or loss of consciousness, seek medical attention immediately. Doctors can check your blood pressure, measure oxygen levels in your blood, and conduct other necessary tests to determine the cause. Lifestyle adjustments also play a crucial role in blood pressure control and reducing dizziness. Ensure that you maintain a healthy diet by minimizing salt and unhealthy fats while increasing your intake of vegetables and fruits. Engaging in gentle exercises such as walking, yoga, or balance exercises can help improve circulation and strengthen muscles. Getting enough quality sleep also aids in better blood pressure regulation. Dizziness and loss of balance can be early warning signs of high blood pressure, and identifying them promptly allows for timely intervention to protect your health. Make it a habit to check your blood pressure regularly and consult a doctor if you notice any unusual symptoms. Proper healthcare not only helps you maintain independence, but also brings peace of mind, joy, and an improved quality of life every day. Symptom 3. Irregular or rapid heartbeat. An irregular or excessively rapid heartbeat is one of the critical symptoms that older adults should pay attention to when dealing with high blood pressure. If your heart beats strongly, without a steady rhythm, or if you occasionally feel as if your heart skips a beat, this could be a sign that your blood pressure is exceeding normal levels and putting strain on your cardiovascular system. This symptom is not only uncomfortable, but can also increase the risk of serious complications such as arrhythmia, stroke, or heart failure. In older adults, the heart and blood vessels gradually lose their natural flexibility, making the cardiovascular system more sensitive to blood pressure fluctuations. When blood pressure rises, the blood vessels supplying the heart are also affected, altering the way the heart functions. You may feel your heart racing as if it is overworking or beating irregularly, creating a sensation of disruption. This feeling may last for a few minutes or recur multiple times throughout the day, sometimes accompanied by shortness of breath, fatigue, or even chest pain. Particularly in individuals with a history of cardiovascular disease, symptoms such as an irregular or rapid heartbeat become even more concerning. These signs could be early warnings of a serious cardiac disorder, indicating that the body is not receiving enough blood and oxygen to supply vital organs. Therefore, if you notice these abnormal signs, it is essential to contact a doctor immediately for an examination and diagnosis. Doctors typically measure heart rate, conduct an electrocardiogram, ECG, and perform other necessary tests to determine the exact cause. Additionally, monitoring your heart rate daily is an effective way to manage your health. You can use a home heart rate monitor to track changes, allowing you to record unusual signs and share them with your doctor during regular health checkups. This helps you gain a comprehensive understanding of your cardiovascular condition and take timely action when needed. Besides medical monitoring, maintaining a healthy lifestyle is also crucial for controlling blood pressure and improving heart function. Adopting a fiber-rich diet, limiting salt and saturated fat intake, and engaging in regular physical exercise contribute to better cardiovascular health and stable heart rhythms. Furthermore, reducing stress through relaxation activities such as meditation, yoga, or simply walking outdoors helps calm the mind and reduce strain on the heart. If you experience an irregular or rapid heartbeat, do not hesitate to consult a specialist for guidance and timely treatment. Paying attention to and regularly monitoring your health is the key to protecting your heart and enhancing your quality of life. Always listen to your body and keep your heart healthy to fully enjoy the joys of life. Symptom 4. Fatigue and shortness of breath. One of the noteworthy symptoms of high blood pressure that many older adults may experience is persistent fatigue and shortness of breath, even when performing light daily activities. If your body constantly feels exhausted and you struggle to breathe, this is not only a sign of decreased energy, but also a warning for your cardiovascular and circulatory systems. This condition may appear when walking short distances, climbing stairs, or even doing routine tasks such as cooking or cleaning. These symptoms indicate that your heart is working harder than normal to supply enough blood and oxygen to your organs, leading to fatigue and discomfort. In older individuals, the circulatory system's ability to adjust is no longer as efficient as before. When blood pressure rises, the increased strain on blood vessels and the heart leads to prolonged fatigue and shortness of breath. This not only affects quality of life, but also reduces independence, making daily activities more challenging and riskier. Sometimes, fatigue can be mistaken for natural aging, but if accompanied by shortness of breath, it is a clear warning sign that requires immediate medical attention. Some people may experience breathlessness during routine activities because their bodies do not receive the necessary oxygen to meet demand, causing a sensation of inadequate breathing, rapid heartbeat, and bodily tension. This condition may result from excessive strain on the heart and circulatory system due to high blood pressure, preventing organs from receiving adequate energy to function efficiently. If left untreated, it can lead to dangerous complications such as heart failure or other vascular issues, directly impacting overall health. Early recognition of fatigue and shortness of breath is crucial for older adults, especially those with a history of cardiovascular disease or high blood pressure. If you frequently feel unexplained exhaustion or experience breathlessness even while resting, schedule an appointment with your doctor for a thorough examination and diagnosis. Your doctor may measure blood pressure, assess heart function, and conduct necessary tests to identify the root cause of your symptoms. This allows for timely and appropriate treatment tailored to your health condition. In addition to medical treatment, lifestyle changes play a vital role in managing fatigue and shortness of breath. Consider maintaining a healthy diet rich in vegetables, fruits, and fiber-rich foods while limiting salt and processed foods. Engaging in light exercises such as walking, yoga, or balance training can help improve blood circulation and strengthen cardiovascular health. Also, ensure adequate rest and high-quality sleep, as they are key factors in helping your body recover after a long day. If you experience fatigue and shortness of breath even during light activities, take it as a warning sign and do not hesitate to seek medical advice. Regular health checkups will help you achieve a safer, higher quality, and more fulfilling life every day. Symptom 5. Declining vision. Finally, the fifth symptom that we need to pay attention to is changes in vision. For many older adults, especially those with a history of cardiovascular disease or high blood pressure, declining vision or gradually blurred eyesight not only affects quality of life, but also serves as an early warning sign of serious health issues. High blood pressure can directly impact the small blood vessels in the eyes, leading to damage to the retina, a crucial component responsible for transmitting images from the eyes to the brain. When blood pressure rises, the blood vessels in the eyes are subjected to increased pressure, which may lead to tiny cracks in the vessel walls or blockages. Over time, these damages can accumulate, causing conditions such as retinal inflammation, internal eye bleeding, or even retinal scarring. These changes result in deteriorating or blurred vision, making it difficult to read, drive, or perform daily activities independently. For older adults, this becomes even more dangerous as it not only affects their ability to care for themselves, but also increases the risk of accidents due to impaired environmental awareness. If you notice symptoms such as blurred vision, partial vision loss, or a general decline in visual sharpness, consider them serious warning signs. Proactively scheduling an eye exam and regular blood pressure checkups is essential for detecting abnormalities early. Eye specialists will conduct retinal examinations using modern methods to identify any early signs of damage caused by high blood pressure. As a result, you can receive appropriate treatment recommendations or lifestyle changes to effectively manage blood pressure, protect your vision, and maintain overall health. Additionally, maintaining a healthy diet with a balanced sodium intake, reducing high-fat foods, and incorporating vitamin and mineral-rich foods such as carrots, leafy greens, and fruits can help safeguard the eye's vascular system. Regular physical activity, especially exercises that promote better blood circulation, also plays a crucial role in preventing the negative effects of high blood pressure on vision. Furthermore, ensuring sufficient sleep and managing stress are key factors in protecting your eye health. Consider monitoring changes in your vision as an integral part of your healthcare routine. If you experience any vision changes, do not hesitate to consult a doctor for thorough evaluation and advice. Early intervention not only improves quality of life, but also prevents severe complications in the future. Taking care of your eye health means taking care of your overall well-being. Always listen to your body and do not overlook any unusual signs. By doing so, you can maintain an independent, safe, and fulfilling life. Golden Glow Health is here to support you on your journey towards sustainable health and a better quality of life. We have now explored the 5 common symptoms of high blood pressure that you should not ignore: frequent headaches, dizziness and loss of balance, irregular or rapid heartbeat, persistent fatigue and shortness of breath, and changes in vision. Each of these symptoms serves as an early warning sign, indicating that your cardiovascular and circulatory systems may be experiencing serious issues. If you notice any of these symptoms, do not hesitate to contact a doctor or visit the nearest medical facility for a checkup and consultation. Early detection and timely treatment not only help manage blood pressure effectively, but also prevent dangerous complications such as stroke, heart failure, or vision problems. Moreover, maintaining a healthy lifestyle with a balanced diet, limiting salt and saturated fats, and engaging in age-appropriate physical activities are essential for overall well-being. Regular health checkups are also key to ensuring that you stay informed about your health status and take necessary actions if needed. Don't forget to like, share, and subscribe to Golden Glow Health for more valuable health information. Thank you for watching today's video. Wishing you good health and happiness. See you in the next video.